Assalamu alaikum. Today we are going to talk about the upper limb. As we can see here, this is the ventral side of the upper limb. How we identify the ventral side is that this is the cubital fossa. This is the part of the scapula that is present ventrally and against the thoracic cage. And in the nails, you do not have in the hand, you do not have the nail beds. How we identify the dorsal side is that this is going to be the dorsal side, and on the dorsal side you have these nail beds. First identify the dorsal and ventral sides. After that identify which structures are present on the medial and which structures are present on the lateral sides. For that you have to locate the thumb. Thumb is always present on the lateral side, so the structures that are present near the thumb, they are going to be lateral, and the structures that are present near the little finger, they are going to be medial structures. Alright, if we come towards the scapular region, this muscle that is present and makes the contour of the shoulder, this muscle is deltoid. After we remove the deltoid, what we can see is that this is the scapular region. In the scapular region, this muscle is the subscapularis. After that, this is the teres major, and this cut muscle is latissimus dorsi. This is the clavicle, and with the clavicle, this muscle is subclavius muscle. These neurovascular structures that are present here are, this is the axillary artery. After teres major, it becomes brachial artery. So if the point of identification is over here, this is axillary, and if the point of identification is over here, this is brachial artery. These are the cords of the brachial plexus and the ultimate nerves that originate from it. This is the lower subscapular nerve, which is present on the subscapular muscle. This nerve is the axillary nerve that is going to wind around the head of the humerus. This is going to be the ulnar nerve, and with identification from little finger, this is the medial side. So this is the ulnar nerve that is going to pass behind the medial epicondyle. This is the median nerve that is going to pass into the cubital fossa. This nerve that is present, if we remove the biceps muscle, this is going to be the musculocutaneous nerve here. This is the musculocutaneous nerve which pierces the coracobrachialis muscle and then supplies the anterior compartment muscles of the arm. Alright, if we see the dorsal side of the scapular region, what we can see is this is the spine of the scapula. Above it is supraspinatus muscle. This is infraspinatus muscle. This muscle is teres minor, and this is teres major, which was present on the ventral side as well. So this is teres major. If we come towards the arm, what we can see is on the dorsal side, this muscle with outcropping fibers, this is the triceps muscle. So triceps brachii has 3 heads. This is going to be the lateral head. This head that comes from within the muscles, this head is the long head of triceps, and this is the medial head of triceps. On the ventral side of the arm, the muscles we can see are the flexors of the elbow, and they are coracobrachialis. If we see here, this is the biceps brachii, and this is the long head of biceps, and this is the short head of biceps. If we remove the biceps, we can see the brachialis muscle. So this was all about the arm. This is the brachial artery. This branch that goes with the ulnar artery, ulnar nerve, is the superior ulnar collateral artery, and this continuing forward towards the cubital fossa is the brachial artery itself. Alright, coming towards the forearm. Here in the forearm, the muscles, if we see the ventral side first, this is the ventral side, this is the lateral side, and this is the medial side. So this muscle is pronator teres. After that, this number 23 is a flexor carpi radialis muscle. After this muscle that has the tendon passing above the flexor retinaculum is palmaris longus. Beneath the palmaris longus is flexor digitorum superficialis. If we remove this, we can see that this is all of it is the flexor digitorum profundus. The nerves and arteries here, this is the ulnar nerve that is passing behind the medial epicondyle and coming towards the medial side. This is the ulnar nerve. Accompanying it is the ulnar artery. These are the anterior interosseous nerves and arteries. And the muscle next to the ulnar nerve and artery, this is the flexor carpi ulnaris. So pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. Beneath it is the flexor digitorum profundus. Alright, if we move towards the extensor compartment, these three muscles that are going towards the thumb, this is the brachioradialis. After that is extensor carpi radialis longus and extensor carpi radialis brevis. These three are a group of muscles. After that, these are the outcropping muscles. They are abductor pollicis longus, first muscle. After that, extensor pollicis brevis, and then this long tendon is of extensor pollicis longus. And between these two, the abductor pollicis longus, extensor pollicis brevis, and the extensor pollicis longus, between these two is the anatomical snuff box. After that, this is the extensor digitorum muscle. This small muscle is extensor digiti minimi, and this is extensor carpi ulnaris. And this muscle, the smallest muscle, is enconius. Alright, if we remove this, we can see supinator muscle as well. Alright, over here, this was the brachial artery. Brachial artery is dividing into an ulnar branch and a radial branch. So this is the radial artery, which we can palpate at the wrist, and then it moves towards the dorsum of the hand. So here as well, it is the radial artery. This is the radial nerve, which we hadn't seen in the arm, but we can see here after it passes the lateral epicondyle, it is giving off a deep branch, this deeper branch, and the superficial branch of the radial nerve. Coming towards the hand, here we have this extensor retinaculum. Above the flexor retinaculum, above the flexor retinaculum is palmaris longus muscle. This is the ulnar nerve and ulnar artery. This ulnar artery is forming the superficial palmar branch, common digital arteries, and then proper digital arteries. This is the ulnar artery. After that, this is going to be abductor digiti minimi. From the thenar muscles, the first muscle we can see is abductor pollicis brevis, then opponens pollicis, and then the flexor pollicis brevis. These muscles you can see between the branches, these are the lumbrical muscles. On the dorsal side, this is the extensor retinaculum. And the muscles that we can see between the tendons of the extensor digitorum longus are the dorsal interossei. This is also the first dorsal interosseous. And the small tendon which is coming with the tendon of the digitorum, extensor digitorum, is extensor indicis muscle. That's it.